Hey guys, how's everybody doing? Give me a few minutes. I don't know what's going on with my internet. I just unplugged the modem, so I'm waiting for it to reboot. I'm on my phone right now. How's everybody doing? Let me know how you guys are doing. I'm trying to get my computer hooked up to the internet. I don't know what's going on with my modem right now. Let's see. How's everybody doing? Hey Alicia. Hey, she's just nine. Joanna. Oh, you said you missed the first open-ended question review. Okay, I'm glad you're here as well. Keldum's World. Hey, welcome. Nisa. Hey guys. Valerie is from Pennsylvania. Hey Valerie. I'm doing good now. I'm just waiting for this, just trying to figure out what's going on with my modem. I don't know. I was literally on my computer and I decided to shut it down just to kind of let it reboot and rest for a little bit because I've been on it all day. And then when I just restarted it, it wouldn't hook up to the internet. So um, my modem is rebooting. So I'm hoping it's okay. Shelly, hey Shelly. Shelly, Lord Casas, hey Lord Casas. Indigo. Kelton's World said, take your time. Okay, I think we in business, yeah. I think we in business now. I think I'm able to get on from my computer now. Hold on, let's see, let's see. Looks like I'm. Let me go. Certification are you taking on Saturday, Christine? Let me know what certification you guys are taking. All right, so I'm in. I'm logging in right now. All righty, there we go. Hey, Keita from Virginia. Okay, enter studio. All right, guys, hold on one second. All right, can you guys hear me? Everybody can hear me? So I'm on my computer now, guys. We're about to get this started. I'm just logging in now. We're about to get this started. She's just nice. Says good luck, Alicia. Okay, let's see. Let me go back. Okay, Christine, she's taking NHA. Oh, Indigo's taking hers on Monday. Hey, Quay. Indigo's taking hers on Monday for the. Okay, she's taking CMA. Christine is taking the CCMA. Sharia. Hey, Sharia. Okay, Monday, CCMA, perfect. Alicia says she's nervous taking the CCMA. Oh, she's taking hers tomorrow. Okay, let's see who Shania. I think that I hope I'm saying it right. CCMA, she's taking her September 6th. Hey, Alexandra from Colorado. Congratulations for passing your exam. Indigo, she's just nice. They're sending you guys good luck. Keita says congratulations to Alexandria. Joanna's taking her September 12th. Awesome. Awesome. Okay. So, few things tonight. We are going to do CCMA practice. For those of you, this is your first time with me. The way we do it, let me go ahead and share my screen now. Let me go ahead and start presenting this. Okay. Share screen. All right. So, if this is your first time here, the way we do it, normally I would do multiple choice questions and I will ask the questions and give you guys a chance to choose the correct one. Then we go through the incorrect answers and everything like that. If you haven't watched those videos, make sure you check those out. But the way I'm doing it going forward is I'm going to do open-ended. And the reason why I'm doing open-ended is because if you can answer these questions open-endedly in the open-ended way, then you know the information, right? And so as we're going through the night, I'm going to do it the way I always do it, where I give you guys a few moments to think about it and choose the correct, write the correct answer. But you won't have the multiple choices to choose from. Okay, so that's how I'm doing it differently, right? So we're going to get ready to get started. And tonight I'm going to also announce the winner. So I just reached 4,000 subscribers. So I decided to do a 4K giveaway. So I will be doing not $4,000 giveaway. So I hope y'all don't think I'm giving away $4,000, but just a giveaway in celebration of reaching 4,000 subscribers. That's what it is. So I hope you guys didn't think it was $4,000. All right, guys. So let's go ahead and get started. So for those of you that are regular here, you already know the routine. Let me know where you're watching from, which I think most of you guys already did. But you know how we do. We want to shout out everybody here. Hold on. We're going to shout out everybody that has passed the certification. So we got Haley J, Sabrina, congratulations to you guys. South Pole 1223, Jamira, Rosie ML, she passed CCMA. Oh, you know what? This should not, hold on, let me see something really quickly. Hold on, let me stop sharing it. Let me fix that because I don't want that. Sorry about that, guys. I don't know how that got right there. All right, let me share this again. Okay. All righty. Let me go back and make sure I didn't miss any. Okay, so I shouted everybody out here. So we got Jasmine here, Lisa, Quay. Quay is on here tonight. Congratulations, Quay. Quay got a 447. Drina, Ruth White. I just want to kind of read some of this right here because this person, right here, she mentioned how I always talk about making sure you know the content. So I wanted to highlight this comment right here. This person is saying that she realized why it is so important to make sure you are actually reading and studying the content and not the actual questions itself. Okay. Let me go back. I think I missed one. But let's see. Hold on, guys. Let me see something real quick. See, this is what happens when the internet acts up. It just discombobulates you all the way because it just messes me. It just mess you all up. My internet issues just made me delete a whole page of people to shout out. All right, let's go back here. All righty. So we did Haley, Sabrina, we did this page here. This was the page that I was missing right here. I knew I had one more page. Sorry about that, guys. I accidentally deleted it. Let me share that screen again. All righty, here we go. Let me go back on that present page. There we go. Okay, so there were some people I missed. But yeah, Janice, Sandra here. Sandra, I want to shout her out because she said third time's a charm. So she took her test a couple times before and did not pass. And so now she finally passed. So congratulations to her. Hannah, Gracie, this person sent me an email, Ashley Tanner. She another person who pointed out the importance of reading and studying the content. Okay. So if you don't get anything else from me, guys, make sure you are reading and studying the content itself and not the questions. So this is the tips. I go over these same tips each time. If this is your first time here, you can go ahead and screenshot these tips. I'll just quickly go through them. Make sure your life is revolving around the study materials, right? Join medical assistant groups on Facebook and network, right? Pay close attention to the wrong answers. You all should have practice tests. I always recommend to buy the practice test if your school is not recommending, not recommending, but it's not providing it for you, okay? Don't focus on more on the questions than you do the content. Create flashcards, have a family member quiz you, especially for those people who may have failed it the first time, right? Those questions where you falling short, right? Maybe have somebody quiz you. Pay close attention to each question, recognizing keywords like what is the first thing you do? What is the first thing you initially do, right? Use process of elimination. I'll be honest with you guys. Some questions you're going to see, You're going to get it correct only by using process of elimination, because you're going to look at some of those answers and you're going to say, you know what, wait a minute, I know this isn't it. So you're going to be deleting the answers that you absolutely know are incorrect. And that's how you're going to reach the correct answers. Also, answer your easy questions first. And there's a way that you can flag or bookmark questions to come back to. So use that feature, because you get 3 hours to take the test, but those 3 hours go by quickly. So bookmark or flag the questions that you need to really think about and ponder on. Okay. So again, if any of you just joining me, we're going to go through these open-ended questions. Okay. Give you guys a few moments to type in the answer, and then we'll reveal the correct answer. At the end, I got a couple announcements, including the winner of the giveaway. All right. So make sure you guys stay with me. Y'all ready for this first question? Let's get to it. All right, guys. What type of surgery uses an extremely cold probe to freeze and kill abnormal cells? What type of surgery uses an extremely cold probe to freeze and kill abnormal cells? Now, why am I doing it this way instead of doing the multiple choice like I was doing before? Because if you can answer questions this way, then you know it. One comment I want to shout out, I don't know if Vampy is on here, but Vampy is normally on here with us, but she talked about how that helped her even more, because she realized if she knows it like this, then she knows it no matter how it's worded on the test. All right, so I see a few people say cryotherapy. Okay, let's see. Cryosurgery, that's correct. Now I see, so I see somebody did, a couple people just put cryo. Why? Because you guys know that cryo equals ice cold or frost. So that is very good. So no matter how it's written on the test, right, you know cryosurgery is referring to using a freezing cold probe, right? Very good, ladies and gentlemen. All right, so next question. What does a modifier do for a diagnosis code, aka a ICD-10 code? What does a modifier do? A modifier. Let's go back to some of these. I see a bunch of congratulations here. Ash says, hi, Miss K. Thank you for all the tips for taking the exam. Oh, congratulations, Ash. Make sure you comment in the regular comments so I can screenshot and shout you out in my next exam practice video. Anybody on here, if you guys know, if you guys have been following me, you know I shout you out in the beginning. So if you want to be shouted out, make sure you comment in the regular comments so I can screenshot and shout you out. What does a modifier do for a diagnosis code? Somebody says explains a possible abnormality. If anything else comes up during a procedure, adds more detail to be specific. All right, let's see. So for a diagnosis code, it makes it more specific, okay? The more numbers in the diagnosis code, the more specific it is. So if you see a question about modifiers, that's what it does for a diagnosis code, okay? And you may see a question that asks, okay, if a diagnosis code has 7 digits, right, or 7 characters, because we know a diagnosis code can have anywhere from 3 to 7 characters, right? If it has 7 characters, that means that is the highest level of specificity as possible for the diagnosis code. So that's what a modifier does, okay? It adds more detail, like Indigo says, to make it more specific, okay? Now, what does it do for a CPT code? What does a modifier do for a CPT code? And somebody said it. They explained what a modifier does for a CPT code when answering that what it does for a diagnosis code. Let's see. I'll give you guys a moment to type it in. What does a modifier do for a CPT code? And somebody had asked me how much administrative stuff is on the CCMA. These study sessions that I do with you should give you an idea. You do need to, be able to answer these type of questions about CPT and diagnosis codes, appointment types. And it's hard to say because, like I tell you guys, each test is different. So you don't know if your test is going to have mostly administrative or terminology or whatever. But my practice session should give you an idea of how much administrative stuff you will have. All right, let's see if something extra has to be done. Additional information. Okay, let's see. Yep, it adds more information about the procedure, like any special unusual circumstances. And who was that? Sharia said that, yep, if anything else comes up. So that means if more than one provider has to be used, if the procedure is done in multiple places, if something happens during the procedure, let's say the patient has a reaction during, they have anesthesia and they have some type of reaction, any unusual or special circumstances that comes about during a procedure. Okay. So the modifier for a diagnosis code makes it more specific. Modifier for CPT code adds additional information, right? So we know that a CPT code has how many digits? 5 digits, right? And when you see those 2 digits added at the end, that is considered a modifier. Okay. Yep, get those two confused. I understand a lot of people do. Yep. Alrighty. What's the first thing you should do if a patient faints? What's the first thing you should do if a patient faints? So let's say you gave a patient an injection and the patient fainted. Or let's say you have a patient with you for some reason the patient faints. For whatever reason the patient faints. What is the first thing you should do? All right, see, lay them down, lay in supine position, lay them down, elevate their legs, call for help and lay them down. Lay them down. All right, let's see. Yep. So the first thing you want to do is place the patient in a supine position, okay, and with their feet elevated. All right, and then, and that's the question is probably going to ask what's the first thing you do. So that's the thing you want to know to do first. Lay them in a supine position with their feet elevated. Now I added the second part just so you know, right? So you want to add a cold compress. And the way they try to get you on the test, you may see an option that says with the head elevated. So because I put here feet elevated, that's not correct. They may throw in there, add a warm compress. Nope, that's not it, because the compress needs to be cold, okay? So that's why I added this on here, just in case you see those other options there, then okay, no, it's not head elevated. The feet should be elevated. The feet, the cold compress, no, can't be warm compress because it needs to be cold, right? And then you want to check his or vital signs, okay? All right. A patient has a co-insurance of 90/10 and his visit comes to $300. How much does the patient owe? And this is another type of administrative question you'll need to know how to calculate how much a patient owes, right? Depending on their co-insurance. You got to know the difference between co-insurance and co-pay. All right, so I'm seeing $30 pop up, co-insurance of 90/10. And you know the difference between co-pay and co-insurance. You guys know the co-pay, that's a set amount that a patient has to pay each visit. The co-insurance is a percentage. So it depends. The amount they pay depends on how much the visit comes to, and it depends on what their co-insurance split is. Okay, somebody says I need explanation of how to calculate it. And we're going to talk about that. Yep. $30. Now, how do we get to that? So the co-insurance was 90/10. So that means that the patient is responsible for 10%. The way you get percentage of a number, you just multiply. So it's 10%. So you wouldn't multiply 0.10 times $300. Okay. Now, what if the patient had a split of 80/20, in which the patient is responsible for 20%? Then you would do 0.20 times $300. Okay. So MN, that's how you calculate it. So whatever you take the amount of, you're going to multiply the amount of the visit. So in this case, it was $300, and you're going to multiply that times, if it's a 80/20 split, you'll do 0.20. So anytime you get a percentage of a number, you're just going to make it a decimal. So if it's 20%, you'll do 0.20. If it was 70%, you would do 0.70. Now, if it's a single digit, let's say you had to do 5% of something or 9%, you would make sure you add a 0 before that number. So it would be 0.05 times whatever if you had to do 5%, or 0.09 if you needed to do 9%. Yep. Thank you, Kelton's World. Kelton's World put the formula there. Thank you. All right. What is the allowed amount? What is that? What does that mean? Allowed amount. What is allowed amount? Allowed amount. I'll give you guys a few moments to type that in. Allowed amount. How much the provider can charge the patient. I see somebody put that. Allowed amount. The maximum amount of physician to charge. Limited charge for the patient. A set amount. All right, let's see. So it's the most a health plan will pay for a service. So yes, you guys are correct. That's the most that the plan will pay for will pay the provider for the service. So another way to say it, the maximum amount that the patient can charge, or that the physician or the provider can charge. Yep. So that is the allowed amount. Okay. And physicians that are in network with that insurance, they have already signed a contract that they will stay within that allowed amount. Okay. All right, what does epinephrine do when used with a local anesthetic? So, what is the purpose of epinephrine when it's used with a local anesthetic? What is the purpose of epinephrine when it's used with a local anesthetic? I see. I don't see anything popping up for this one yet. I don't know if it's just delayed, but I'm gonna go ahead and go. I'm gonna go. Let's see. Okay, somebody says slow bleeding. All right, so epinephrine is a vasoconstrictor. It helps reduce bleeding and it also prolongs the effects of the anesthesia. Okay, so make sure you know that, make a note of that. So, in case you see it, you know what epinephrine is when it's used with anesthesia. Okay, the purpose is to help reduce bleeding. Okay, so it's a vasoconstrictor, meaning it narrows blood vessels, right? It helps reduce bleeding and it prolongs the effects of the anesthesia. Okay. All right, when preparing a patient for a rectal exam, which position should they be placed in? Got to know those positions, guys. I think the next couple questions I got on here are about positions. You got to know those positions. Know each of those positions. When preparing a patient for a rectal exam, which position should they be placed in? Okay, I'm seeing SAMs. All right, let's see. Yep, the most common is SAMs. Yep, can also be knee chest, but it's going to be SAMs is going to be that. You wouldn't see an option, but with both of them as an option, knee chest or SAMs, because they both can be used for rectal exams. But yes, SAMs is the most common. Very good. All right, which position is used for pelvic exams? Which is used for pelvic exams. So make sure you guys know these positions. And so when you see questions about it, and you can see any even though I only got a couple different positions on this practice session, you can see any of them. So make sure you know all of them. All right, I see lithotomy, and you are correct. Lithotomy position. So I see you guys know these. So make sure you know them all. Your Fowler's, your semi-Fowler, Trendelenburg, dorsal recumbent, supine, prone. Make sure you know all of those positions. All right, what's the process of destroying all forms of microbial life? This is the most effective, what's the word I'm looking for without saying the word? The most effective way of cleaning, I should say. The process of destroying all forms of microbial life. All right, I'm seeing sterilization. All right, let's see. Yep, sterilization. Sterilization. Make sure you guys know the difference between sterilization, sanitation, and disinfection, okay? Because you'll see those questions like that about what should you do. Like there's a question that asks, after you use EKG electrodes or the EKG leads, like what's the process of cleaning them? You got to know that that's disinfection, right? Sanitation is the most basic one. All sanitation does is just reduces the number of microorganisms. Disinfection will kill some and make some inactive, and then sterilization is the complete destruction of all microorganisms. True or false, if a patient is crying, you should assure them that there is no reason to cry because everything will be okay. Now, of course, you won't see any true or false questions on the test, but I worded it like this, so that way if you see it on there, you know the answer is period. Like if the patient is crying and you know what to do when you see them crying, it shouldn't matter how it's worded. That's going to be false. You never give unwarranted assurance. Allow the patient to cry. So if you see that question, it's allow the patient to cry. You can eliminate everything else. You're not going to tell them it's okay. You don't ask what's wrong. You allow the patient to cry. Give them their moment. We never want to assure the patient that it's going to be okay. So if you see any of those questions where tell the patient it's going to be okay, we can't give that because we don't know if it's going to be okay. And even if we do know, that's the provider's job. If the provider doesn't tell us to let the patient know it's okay, then we can never give unwarranted assurance. That's what that's called, unwarranted assurance. And what part of the ICD-10 manual, CM, should an assistant begin when looking up a diagnosis code? Where should you begin? So this is another thing you need to know, like on the administrative side. Where should you begin looking? What part of the manual should you begin looking? Let's see, give you guys, I don't see anything popping up yet. Okay, somebody says procedure. All right, let's see. So it's going to be volume 2, the alphabet index. So make sure you know the alphabetic index, okay? So that's the first place you're going to go, the alphabetic index, all right? And then you can cross-reference it in volume 1, which is the tabular index, okay? So it's going to be the alphabetic index. That's where you're going to go first, and then you can cross-reference it in volume 1, okay? So that is something you'll need to know. So it wouldn't be procedure because the procedure is the CPT codes. Diagnosis code or ICD-10 codes are the diagnosis, okay? Which abdominal quadrant is the stomach located in? You got to know these quadrants and where these organs are located. You will see questions about the quadrants. Which abdominal quadrant is the stomach located in? Somebody said left upper. Somebody said upper right. LUQ, upper left. Right upper. Okay, let's see. It's the left upper quadrant. Okay, so know those quadrants. If you don't know where each organ is located, make sure you look those up. It's the left upper or LUQ. All right. Which abdominal quadrant is the gallbladder located in? The gallbladder. The gallbladder. Where's the gallbladder located? Hey, coach. I didn't know you were on here. Hey, coach. You cheating. Okay, let's see. Right upper. Upper right. She said I get confused with these. That's right. That's why we doing this, Alicia. Exactly why we do it. So just remember your left is your patient's right. So when you're looking at it on the picture, it's going to be on your left side, right? But that's the patient's right upper quadrant, okay? Which abdominal quadrant is the appendix located in? Which is the appendix located in? Gotta know these. You gotta know what these organs are. A couple of you guys said you're taking yours tomorrow. Somebody said they're taking theirs on Monday or Saturday. Make sure you know these quadrants. Okay, somebody said RLQ, right lower or lower right quadrant. All right, let's see. Yep, right lower quadrant. Okay, so if you didn't know any of these, then you know one of the other things you need to study. Okay, know which organ is in each quadrant. All right. All right, convert 72 kilograms to pounds. How are you going to convert that, and what is the number? Convert 72 kilograms to pounds. Yes, this is one of the things you need to know. I get questions about how much pharmacology is on a test. There's not a whole lot. There's basic things like converting kilograms to pounds and vice versa, Celsius to Fahrenheit and vice versa. What else? Inches to feet, inches to centimeters. Make sure you know how to do that. What else? Milliliters to teaspoons, tablespoon. You got to know that. All right, let's see. 2.2. She says, I know, but no calculator. All right, so you guys said 158.4. You're correct. So in order to convert kilograms to pounds, you're going to multiply by 2.2. To convert pounds to kilograms, you're going to divide by 2.2. Now, when you go take your test, they will allow you to certain calculators you can bring in. You can bring a regular calculator in. It just can't have any letters on it. It has to be a regular basic calculator because you can't take your phone in there. And then they'll give you scratch paper, and some computers may even have a calculator opened up for you. I think I remember when I took my test, I think it was a calculator on the computer that I was on, I believe. Yep. So pounds to kilograms to pounds, you multiply 2.2. Pounds to kilograms, you divide by 2.2. Yep. Thank you, Keldon's World, for the equation, for the formula. Thank you. All right. How do you instruct a female patient to collect a clean catch urine sample? What do you want to tell her to do? I'll give you guys a few moments to write that in. How are you going to instruct a female patient to collect a clean catch urine sample? When you ask for a calculus, they said there was not. Yeah, so it probably depends on where you go, because even on NHA's website, it does tell you the centers that they test through PSI. Even on their website, it'll tell you that you can bring a basic calculator. So it's probably depending on where you go. So somebody says with the labia spread, somebody says wipe. Oh, that was retracted. Alrighty, so with the labia spread, you tell her to urinate a small amount into the toilet first and then collect midstream, okay? So collect a midstream, urinate a small amount into the toilet before collecting a sample midstream. Yep. All right, true or false? A heart rate of 140 is normal for a 6-year-old child. True or false? Is a heart rate of 140 normal for a 6-year-old child? I know what you meant. She's just not. And you want to know your normal heart rates for adults and children, respiration rates and things like that. That's another one you want to make sure you know. Your ranges, you want to make sure you know your normal temperatures, make sure you know your normal heart rate, blood pressure, respiration, right? Make sure you know those things. Okay, false. So the normal pulse rate is 70 to 130 for a 6-year-old, okay? So make sure you know that for an adult as well. Which is, what was that? What is it? 60 to 100 for an adult. All right, true or false? A respiration rate of 22 is normal for a 6-year-old child. Is that true? Respiration rate. Again, make sure you know these rates. Respiration rates, pulse rates, blood pressure, temperature. Make sure you know those normal ranges. Respiration of 22, is that normal for a 6-year-old child? All right, let's see. Yep, that's true. 18 to 30. 18 to 30. All righty. True or false? HSV1 causes cold sores. HSV1 causes cold sores. Is that true or false? All right, I'm saying true. Yep, HSV1 is herpes simplex virus type 1. And yes, it does cause cold sores. What does CPR stand for? Gotta know that. What does CPR stand for? I think these next few ones that I got are abbreviations, I believe. You want to know these common abbreviations. Cardiopulmonary resuscitation. Cardiopulmonary resuscitation. Looks like most of you guys got, a couple of guys got that. Yep, cardiopulmonary resuscitation. All right, guys, what is PRN? What does that mean? What does PRN mean? So if you see a question and it's asking you about the patient has to take, I don't know, 50 milligrams of a medication, PRN, what does that mean? All right, as needed. Okay, that's correct, as needed. What does AC mean? Patient has to take a medication, AC, what does that mean? Coach, are you still on here? Remember BT? Alrighty, you guys are saying before meals. Let's see. Yep, that is correct. So you guys are on it. Yes, this is exactly things you need to know. Yep. Alrighty. What does PC mean? What does PC mean? PC. So PC. Y'all are on it after meals. Okay, y'all are on these abbreviations. What is HS? What is HS? What does HS mean? Patient has to take a medication, HS. Not HX. Y'all are saying history. HX is history. HX is history. HR is hour. HX is history. HR is hour. HS is at bedtime. So if a patient has to take a medication, HS, that's bedtime. So those of you that chose wrong, make sure you add that to your notes. It's bedtime. HS is bedtime. All righty. What's the OSHA Form 301 used for? What is that used for? Oh, Jocelyn says she has her test on the 26th. Okay, Jocelyn, we are wishing you luck on that. Make sure you're studying. Which test are you taking? A CCMA? Another thing you want to make sure you know about OSHA for the test, make sure you know what the general duty clause is. Okay, make sure you know what's general, and make sure you know what right to know is, okay, for OSHA. The right to know, make sure you know what the general duty clause is. What's the OSHA Form 301 used for? Safety for an employee that gets hurt. Oh, congratulations, Natasha. Make sure you comment on the regular comments too when the video posts so we can shout you. I can shout you out on the next exam practice video. All right. to report incidents. Yes, it's an incident report form for work-related injuries or illness. Okay, make sure you know that. The OSHA 301 form or Form 301 is for work-related injuries or illnesses. Okay, so it is an incident report form. So that's correct, Lisa. She just now said congratulations. Okay, John said she's taking a CCMA. I've been watching. Oh, you've been watching since June. Okay, glad you made it to a live session, Jocelyn. All right, what's a quality control log? What is that? What is a quality control log? What is that for? What is quality control? You got to know what quality control is. What is quality control? What is the log? Natasha, they're congratulating you in a comment. To ensure medical supplies are working properly. Anybody else? Somebody says a day sheet. So it's not the day sheet. The day sheet is to log transactions, financial transactions for the day. To make sure their supplies, not quite. Let's see. It's used to document the results of controlled testing, which ensures quality results of equipment and testing materials. So remember, quality control testing, that means that you're testing the equipment in the office, right? Like the oxygen tank, the eye wash station, the glucometer, anything that you use on a regular basis, especially if it's things that you need for emergency purposes. You have to do control testing. You mean that you go through and you test those things and you have to keep it on the log. That is quality control testing. And the log is where you log that it was working, right? So that depending on where you work, it may be every week, it may be every day. Okay. That's quality control testing. It's testing the materials, the equipment, and testing materials to make sure they work. Okay. Yeah, daily check to make sure equipment is working efficiently. Exactly. Somebody says I'm taking the NCA tomorrow. Have been watching and studying. Yes, definitely, Emmy. If you haven't checked out on any of the other videos, make sure you do. Yes, this will definitely help. Everything that I go through is stuff that I get directly from the practice test, and this is the material that's going to be on the test. It won't be the same questions, but the content is the same, and that's why I'm doing it like this instead of the multiple choice way that I was doing it before, because doing it like this ensures that you know it. If you know it, whether you see it or not. Okay. So this will absolutely help. What's the CMS 1500? If you've been on here with me before, you know what this is, because it seems like a question about this come up on each one, each practice test, or whether it's the CMAA or the CCMA. Oh, Shelly, you're taking your test tomorrow as well? Okay, Shelly. Those of you that's taking your test tomorrow, make sure you come back and let us know you passed. So it looks like you were trying to type encounter. It's not the same. So encounter and the claim form, and the CMS is not the same. So the encounter form you do use to fill out a CMS 1500, but it's not the same. And I do have a video on this channel, the difference between the encounter form and the CMS 1500. So make sure you guys look at that if you have never seen either of those. So that's the universal claim form. And I accidentally said it a second ago, claim form. But yes, that's a universal claim form. So it's not the same as an encounter form. It does not have pre-printed codes on there. So if you see that question on there, what is the form that has pre-printed codes, diagnosis codes, and CPT codes? That's the encounter form. The universal claim form is what you have to fill out using the encounter form. So it's not remittance. Remittance is an explanation of benefits that goes to the provider that details that shows the claim details, what was paid, denied, or anything like that for a visit. Alrighty. Oh, that's it. Oh, I thought I had more. So that's it for tonight, guys. I hope that this was helpful for you. I got a couple announcements, so make sure you guys stay on. If you haven't already, make sure you like the video, and exit out the chat, like the video, right? Share it with a colleague or a friend, right? Okay, so let's see. Oh, I mentioned here, make sure you share. Oh, one-on-one sessions. So I've been doing one-on-one sessions with a few of you guys already. it was highly suggested to start doing one-on-one sessions. So that's what I do now. It'll be in the link in the description of the video. It's on the channel somewhere if it didn't automatically show up for this video. So make sure if you guys need help with your resume and cover letter, or if you need some more one-on-one help with your exam practice, you can schedule that. You can always email me too, but if you just need that more specialized one-on-one help, you can do that. Let me know if you have any questions down below. I'm going to stay on for a couple minutes to answer questions. If you have any questions below, make sure you put that down below, okay? Now, like I mentioned, I do have a couple announcements, okay? One of the announcements that I have next Tuesday, guys, I want you to set a reminder. I'm going to have a very special guest on here with me. And he is actually in the comments right now, commenting and doing exam practice, which I told him he's cheating because he knows this information. But guys, I really want you to set a reminder for Tuesday at 8:30. I'm going to have Brian Coachman. He is an office manager, and he's also been a medical assistant for 9 years. He and I are going to have a live discussion on Tuesday, and we're going to be answering questions. He's going to be just talking to you guys from his perspective as working as a medical assistant, and he worked his way up to office manager. He and I also used to teach together. We taught medical assistant classes together for 3 years, and he's literally one of my best friends. He's like a brother to me. So I want you guys to tune in on Tuesday. Set a reminder now at 8:30. Okay. I want you guys to get on with us. Okay. And now I'm about to make the announcement for the winner. I don't see her on here. I was hoping she would be on here. So I'll post it on my channel later for the winner for the 4K giveaway. Let me see. I see a couple questions. Somebody says, have you done NHA phlebotomy practice question? No, I haven't done any phlebotomy. Maybe I will eventually. I don't actually have access. I will have to buy that access. I don't have that access, Gracie. But maybe in the future I will, because I did have a couple people ask. If enough people request it, then I will. Like I said, I will have to buy that. But so I don't know yet, Gracie. We'll see. MN says, can you do questions about the Children Medicine Administration? I can. I'll include that on the pharmacology, the dosage calculations about children. And this, yeah, I can do that. Shelly says she's watched all the CCMA videos. Awesome. She knows the questions will be different. The content, yes, will be what I cover. Exactly. The questions will be different, but the content is the same. So no, is the test the same for CMA? No, it is not. CMA is a completely different test. It's more broader. Now, some of the same information will be on there, yes. But if you're taking a CMA, I always recommend to use the CMA study guides and practice tests, okay? No problem, Linda. Do you have for the NCMA to go over? I will search those type of videos. So again, so the same information will be on there, but it won't be all the same. So definitely search practice questions and study content for that. Okay. You're welcome, Gracie. She's thinking about taking a phlebotomy exam. You're welcome. So guys, again, make sure you set a reminder for next Tuesday, the 23rd at 8:30 p.m. I'm going to have Coachman on, Brian Coachman on. He is in a comment. Say something, Coachman, and if you're still here. So I really want you guys to tune in, especially for you guys that have questions and you want to work your way up. Tune in with us on Tuesday, okay? Now, for the winner of the contest, you're welcome. She's just not. The winner of the contest was Rosie ML. Congratulations, Rosie. So make sure you email me. Oh, let me tell you this. The person, I'm going to end up having to do another giveaway because I did a birthday giveaway and I had the way we did it. I had everybody comment, right? And I put everybody's name on the paper and I had my daughter pick the name. That's how I do the contest, right? The person that won last time, she never got back to me. So I'm going to end up probably having to do another name for that. I was trying to do a giveaway for my birthday. The person never got back to me. So Rosie ML, if you're watching this, I'm going to announce it on my page on the channel. If you don't get back to me within the day, I'm going to choose another winner. Okay. So Rosie ML, you are the winner for the 4K giveaway. You got to email me right away, Rosie, or comment if you're watching. Okay, there you go, Brian. He's here. Coach, he's here. So he's going to be with me next Tuesday. Does anybody have any more questions before I let you go? Any more questions? anymore. I don't see anybody popping up. I'll wait a couple minutes to see. Are we going live again? Probably next Thursday. I have some time now, so I'm going to try to do a live at least once a week. Tips for medical coding. So we don't get too deep into medical coding. The biggest things for medical coding, PJ, is making sure you know the difference between the CPT codes and ICD-10 codes, where to look in your manuals. What else? You don't have to know specific codes for anything. Like they're not going to ask you what is the ICD-10 code for chest pain. Well, I don't want to say that. It depends on what test you're taking. For the CCMA and the CMAA, definitely not. The CMA and RMA are more broader. That's why I always say make sure you study that content, because I don't want to speak for those tests. But I know for the CCMA, CMAA, the most you have to know, of course, what modifiers do. Make sure you know how many characters each one has. How many diagnosis codes can go in a claim form, up to 12. How many CPTs? I think it's up to 6. Things like that for the test. I don't teach billing and coding, PJ, so we only kind of scratch the surface. Lisa says, be sure to like the chat. Thank you, Lisa. If you haven't already, make sure you exit the chat and like. Thanks so much, Lisa. Are you asking to see? I don't know. I don't know what the NCMA. I have to look that up. I don't think it's the same as C. What is the NCMA? What does that stand for? I'm guessing it stands for National Certified Medical Assistant. That is my guess. Emmy. Love your videos, Maria says. Thank you, Maria. Thank you. She's just not. That would be great if you're able to do that to get a few more sessions. Okay, before you're done. Yes, definitely. I'm going to definitely try next week. Thanks so much from this old lady. Oh, she said, thanks, Charissa. Thanks so much for this from this old lady, because but until Monday, pray. Sharia, did we have a session, Sharia? I think I can't. I had another lady. I did a one-on-one session with an older lady last week. Was that you, Sharia? I can't remember. I don't think so. I think I will recognize the name. Oh, National Certified Med. Okay, I thought so. Yeah, that's what the NCMA is. So I will look up that study material. Alicia says these videos are so helpful. I'm glad. No problem, Lisa. You have a good night too. Okay, so that wasn't you, Sharia. Okay, I do remember seeing your name here before. That's why I couldn't remember if it was from here or the session. All right, guys, I'm going to let you guys go. Don't forget, set your reminders for next Tuesday for me, especially for those of you guys who have questions about what office managers look for in a medical assistant and things like that. He works in a nephrology clinic. So we're going to be talking about that next Tuesday at 8:30. Set your reminder. Make sure your notification bell is checked, so that way you'll get notified when I schedule it and when I go live. You have a good night too. She's just now. And Rosie ML, if you don't get back to me by the end of the day tomorrow, I'm going to have to pick someone else. All righty. Good night, guys.